Okay, so our pandemic dashboard, and so I'll just update you on our numbers in Suffolk. So this slide was created earlier this week, and we have good updates. So when it was created, we had about 30 new cases per 100,000, and that number has actually decreased to 25. Our percent positivity on this chart is listed as 10, but this week it has decreased to 8.4. Our state percent positivity is about 6, so we're really moving in the right direction. Additionally, we do not have any outbreaks at this time, and our percent of cases in healthcare workers is about 2.8, and that's always important to look at because our healthcare workers are providing services and they need to be available and healthy in case we did have a surge. So that's why that's important. Next slide, please. Vaccine update. We now have 3 vaccines that have been approved by the EUA process: Pfizer, Moderna, and Johnson & Johnson. In Western Tidewater, we are currently utilizing Moderna and Pfizer. These are both mRNA-based. Moderna is 2 doses, 28 days apart. Pfizer is 2 doses, 21 days apart. Next slide, please. So now that we have Johnson & Johnson available starting at the end of this week, in just a few health districts, we know that this is 72% effective in preventing moderate to severe disease. An inactive virus protein induces immune response to COVID. That's the mechanism. And this one is super exciting because it's only 1 dose. And it can be stored in the refrigerator for up to 3 months. So if we remember, that was one of the issues why we did not initially have Pfizer, because it requires special storage. But this is really good. So once this is pushed out fully to all of the health districts, it will be easily stored. Let's see. Under current VDH guidance, they prefer that the Johnson & Johnson vaccine only be used at mass vaccination events that are over 1,000 people. Next slide, please. So this is a repeat slide. Why do we provide mass vaccinations? Vaccines reduce the number of susceptible individuals in the populations, prevent morbidity and mortality due to illness, and reduces transmission through herd immunity. And I do have to make a correction. At a previous presentation, I said herd immunity was about 1/3 of the population. In actuality, it's 75%, but that 75% does include those who have passive immunity. That means that they were directly affected with COVID and now have immunity, whereas people who have been immunized. So those are just the 2 types that can make up the 75%. Sorry, guys. Next one, please. All right, so this just reviews the city distribution plan. Our allocations are determined by the state, not the district. We still are on population-based allocation, and Suffolk is about 1% of the population. Group 1A is healthcare providers and long-term care facilities, and we've moved on to Group 1B, which are our frontline staff, police, corrections, daycare, and schools. I think we are currently doing our teachers. I'm not sure if it's first dose or second dose. We are moving on soon to food and agriculture, manufacturing, grocery store staff, public workers, public transit workers, mail carriers, and city officials, as well as those 16 to 64 with major chronic illness and 65 and up. So who can vaccinate? Our hospitals, health department, our pharmacists, and our local providers. So we are currently doing weekly events at the health department in Suffolk, 100 doses each Friday, give or take. All right, next slide, please. So what's new? We do have a centralized call center now. The 1-800 number is 877-829-4662, and this is from 8 a.m. to 8 p.m. And we also have a website, vaccinate.virginia.gov, and this is, you can call or you can email and pre-register to get on our vaccination list. So next slide, please. So prior to the statewide call center being set up, the city supported us with a local call center, which to my knowledge is still up and running, but across the state, they have had reduced calls at the local call center as the statewide call center supports more of the calls. Recently, March 1st and March 2nd, we had a Bayview Medical Group event, and this number needs to be corrected. They actually offered 2,500 vaccines to our citizens at the Hilton. Additionally, our new EMS partnership, they have actually expanded our efforts, and they are able to do vaccinations on site. So that is really helpful, and we plan to use them for additional events. Federal pharmacy partnerships with Walgreens. So there are a few Walgreens in our district that have their own allocation that doesn't come from the health district, and they're allowed to vaccinate. So this is just expanding our reach. So this is really great. And we continue to partner with our local pharmacies and practices. And as of March 1st, Suffolk had administered 15,577 doses. Next slide, please. All right, vaccine equity. So this slide might be a little bit confusing. So technically, this is the amount of race information we have received, but there could be a lag. So for the past few weeks, that data probably is not in. And also, people do not have to disclose their race, but this is from the race information that has been inputted when people receive their vaccinations. So 160 Latino, blacks 2,554, whites 4,935, Asians 148. So we are going to be partnering with Suffolk Coalition of Black Pastors, specifically Reverend Blunt. We have discussed what our next steps are, how we are going to reach the community, those who are more vulnerable and do not have internet access and do not have email. So we've discussed ideas such as having churches create a list of their vulnerable citizens who cannot register online. In addition to that, we've discussed having churches support events. We're going to look into how we can get out into the community and meet the people where they are, so our equity can be improved. Oh, and also the biggest part is communication. So we're going to work with the churches and see if they're doing town halls to make sure that those who are offered the vaccine are comfortable and knowledgeable on what it entails, what the vaccination process is a part of as well. And lastly, let's see. Oh, I think I did mention that we did a church event at East End Baptist Church with Reverend Faison, and that was about 1,000 vaccines for the community of Western Tidewater. And this last slide, we are still in phase 1, but as you can see, we're on the upslope. So as the current vaccine pharmacy companies ramp up, we hope to be able to move away from our prioritized populations and just focus on general population without constraints. So the hope is that as we get larger doses available, we will be able to do more and more. And then the last phase 3 is when vaccines are readily available, just like the flu shot, at your everyday pharmacy, urgent care, primary care. So the end goal is phase 3, but we're moving towards phase 2, which is really good. That is all I have. Questions?
Thank you, Dr. James. Council, questions, comments?
I
Councilman
have one
Johnson.
question. I'm sorry. Dr.
sir.
James, thank you. The world is looking better, right? It is looking better.
Thank you for that.
My question, though, I was glad to hear you talk about the churches, because I'm from rural Suffolk, and particularly in the African-American community. Is there any way we could possibly do like small vaccinations at the rural churches? Or I've had several phone calls of people that are interested. And do you have a liaison person that I could contact? Or
So we do not have a current liaison, but if you want to create a list, we're just going to use our current leadership team, but that is a good point. So what we're trying to do is, reach out through the churches and different community organizations so that we can set up those things to reach those communities that might not be super close to a health department.
and some of these folks don't have transportation. That's my concern, particularly in the Holland community and out in the rural part, and also in Wayleable, I'm speaking, we do have a concern. So thank you. I was glad to hear that.
Okay, yeah, and as we have more resources, just like we talked about the EMS partnership, once we have a list, that might be something that our EMS partners could set up a site that's, in the community.
Thank you very much.
But yeah, if you want to forward me that list, that'd be great.
I will.
Thank you.
Thank you.
Mayor?
Yes, thank you, Dr. James, for your presentation. And a couple of things is, where is we going to be able to go into the churches? I think what I was looking at if we could get with some of the ministers or churches and have them form a group, a number from each church, then they could come together and say, okay, I have 20 or 25 people that's ready for taking the shots. Then that will sort of get it into the community more. Because what they are finding here is that, like Bayview, when they had theirs yesterday and Monday and Tuesday, that population were way out. It was not taking care of the people in the downtown area, basically. And looking at the numbers that you showed, where it was 2,000 blacks and double that in whites, and that's a problem, because we are not getting the others the opportunity for some reason. I don't know what it is, but I've attended quite a few of them, and the numbers just doesn't add up with who I'm seeing. They're taking the shots. So we got to have some kind of equity, some way of getting this changed where people will be able to get registered. And I think maybe by doing some of it through the churches will help a lot because they're there with the people. They know the people. So that was just one of the suggestions that I want to make to take a look at. And maybe, I know Dr. Blunt and my pastor and all the others be more than happy to work together to try to form some type of list for that.
Yes.
Now, with the Johnson & Johnson, I think we are supposed to be getting some here in the Tidewater area from what I'm hearing. Is that correct?
So it has been designated for large mass vaccination events. So to my knowledge, we don't have any 1,000 or person event. When I say mass vaccination, so it wouldn't be like a Bayview event. This would be like a true community event.
Right.
So I do think there are other districts that have like a true, just the community come out. For example, like when we do the flu drive. So they really want the Johnson & Johnson to be open to all. We don't want to appear that we are targeting it towards a specific community, even though we know it's a very good vaccine. Right now, the approach is that it be at large events. If that makes sense at all?
It makes a lot of sense
Okay.
because listen to a few people talk about the difference. You might have to sell the Johnson & Johnson because what they are hearing is it's a good vaccine, but it's not quite as good as the Pfizer and the other one. So some people in their mind, I guess the mind plays putting things on you when you, well, what am I going to get? But they should take the shot regardless. The first one they can get, that's the one they should get.
Yes, the first one that's available is best, but they do have options. That's what we want to stay away from. We don't want people to feel like this is my one option. We want them to have different options.
Okay, thank you very much.
Yeah. Councilman Ward?
Yes, thank you for the presentation, and I've been thanking, especially the city. I have seen a couple of times they had shots, and I think we're very organized what we're doing in the city of Suffolk. I really appreciate that, but I just got to know when we coming up northern Suffolk. I mean, been down here a couple of times. I want to know when we coming up northern Suffolk. We got some facilities up there. I think that we'd love to have the opportunity for the elders. Probably got the Saints, got Little Grove Baptist Church up there, and I like to see can we get something going on up in the Pewsville section and the Huntersville section.
If you'd like to send me an email, I can make
Okay.
sure we kind of just have a list going
Okay.
and rotate it
Okay.
regularly through those communities that we
I will.
haven't. Because you're right, we've been very,
Thank you.
we've been very limited. But
Okay.
once again, as allocation increases, we'll be able to do more across the district, the very large district.
I thank you again for your time that I asked. Thank you for your time.
Thank you.
Speakers, Councilman Williams?
Yes, Dr. James, thank you. Great presentation. I'm glad to see that the numbers are going down. That's wonderful news. I'm glad that Johnson & Johnson is on the market now, and they're going to be helping a lot of people. I do have two questions. I want to piggyback off what Councilman Johnson said. I received several calls from the people or my constituencies all in the Wellerville, the rural area, they are concerned because, again, they don't have transportation to get downtown Suffolk. And I was just wondering, Mr. City Manager, if we could get with Dr. James and the staff and maybe look at the Wellerville Center as a spot where we can administer shots in the future. There's a need in the area. Again, people just don't have the transportation. And the other concern, and I seem like I remember you saying this previous meetings as it relates to people wanting to sign up at the different pharmacies in other locations, and they're worried about the out-of-pocket expense that they may incur because they don't have insurance. So will there be an out-of-pocket expense? You don't know.
But that's a good question. Anything that's through the health department, we do not charge. But if it's a medical facility or a pharmacy, they can charge an administration fee. So I would, ask those people if they are concerned about a charge to go through the health department, because we're not allowed to charge, but we can't control what private practices are, they do. That's a good question.
Thank you.
Dr. James, thank you for your presentation. I know about 30 days ago I was kind of hard on you. It's amazing how far you've come in 30 days. I mean, the progress that's been made by your department, the state, the help of city staff. I mean, virtually the type of complaints that I was getting 30 days ago, they're almost been reduced to nothing. So whatever we're doing right. We're getting the information out. People are starting to see some progress. I did have one question for you in regards to the Bayview event on Monday. Just so happens I received my first shot. Now that I had COVID-19, I decided to get a shot. But anyhow, I was on the waiting list with Bayview, signed up about a month and a half ago, being one of their patients, and I was notified about the event that was held at the Hilton Garden on Monday and Tuesdays. It seems that somewhere along the line, I got a couple phone calls it was my understanding that Bayview, I guess they're the ones that held that event. It was their personnel, and it was for Bayview patients with appointments, because I know they were very specific when they set mine up about a week out. I must have gotten 8 different text messages or emails, be there whenever I signed up, 10:10. But there were individuals that showed up at the Hilton Garden that expected to get vaccinated, and they did not. Could you just explain how that particular event was arranged and what transpired?
Okay, so that was the Bayview and Health Department collaboration. So the new distribution is that the allocations for vaccine are mostly designated through the health department. So Bayview was given specific allocations so that they could vaccinate the Western Tidewater community, specifically in Suffolk. What we did is from the pre-registration list where people were able to put their email information in, we took that list and gave it to Bayview, and they crossed it with a list of their patients so that some of the people from the list, our pre-registration module, they were able to kind of move through this process instead of having to wait for an actual health department event. So to keep the event organized, Bayview did have to create a schedule, and within that schedule, that's important too, because that affects how much they can give and how much they're allocated to distribute. So it is very hard to take walk-ins if you already have a process. But to my knowledge, they were able to work in some, and that is based off of no-shows. And they're also, not to get into the weeds, but when you drop the medicine, I'm sure you all have seen on the news, some people are able to get more doses than others. Probably if I was drawing it up, maybe not me, but those experts. So often they could work in a few extra people. But it's very important that they stay organized so that they follow that process and don't create waste, and also don't not serve the people who had appointments.
So the process that was followed was proper in the way that the vaccinations were administered, the way it was set up by appointment, and their as far as their allocation of vaccines through the health department, because they came through your department, correct? So that was a joint effort to get that done.
Right,
And
right.
I would like to say it was very, very, very well run. I mean, I was in and out of there in about 20 minutes. They had it down to a science, and actually went back that afternoon. I thought it'd be a good place to bring a therapy dog, so we brought dogs back.
Oh.
Yeah, so they weren't, well, I went back Tuesday. But anyhow, yeah, it was one of the best run events. I mean, I know we've had some good ones, but I appreciate, what the Hilton Garden did, and I appreciate what Bayview did and what you did in partnering with them to make that happen, because I think that was with 1,200 vaccines plus or whatever.
Yeah, I think the 2,500 over both days.
Over both days,
So
yeah.
that's really good. That's a good amount.
Yeah,
We're working our numbers up.
Yep, that's
Yeah.
phenomenal. And like I said, I appreciate, how far we've come in such a short time, and that was only accomplished through a collective effort from your department, institutions like Bayview, the city manager, and everybody else. So I appreciate it very much.